So welcome. My name is Dr. Rosie, and I'm so glad that you guys made it tonight. And I know that my biggest passion is this talk. We get to transform lives tonight, and by the time you're done, we want to make sure that you understand what health is, and then we're going to go and specifically explain to you what your x-rays look like and what we're going to plan to do to start changing the circumstances that you're in. And so when people come here, I think the biggest struggle is people need answers. I come from a family that unfortunately, they didn't have a great health. My mom died prematurely. My sister at 47 just passed on here about a couple of years ago. And now my dad struggles because he had a heart attack and is paralyzed. And so my sister and I have been caregivers for him and my mother-in-law. It's just been one of those things that the circumstances I really feel that God places in our lives are for a reason, and I thank God for them. But it does allow us to grow and start changing our own lives. And so tonight, what we want to really define is what health is, because people most of the time, unfortunately, don't really know what it is. And unfortunately, like my dad, he had no clue. He had cardiovascular problems until he got the first heart attack, and he had, most of his arteries clogged. And that's the problem with America right now, that these top-leading killers, you don't have a symptom until it's already there. So what we want to make sure is that we don't wait till it happens to do something about our health. I actually have the benefit to work with athletes and wellness people. I work with Olympian athletes. I've been working with them since 2009, and they're sometimes the hardest because of the fact that they believe that what they do, and I'm an advocate of exercise and doing the right nutrition. But they really believe because they're doing the right things. And yes, we're going to teach you how to eat right. We actually teach the 5 essentials, and so the 5 essentials all include everything about how to remove those interferences and those obstacles. But what I'm trying to get at is you can do all the right things, and yet you have like somebody like Lance Armstrong that still died of cancer. And so this is where we want to define is what health is. And so most of the time people base their health on how they feel, but the definition specifically, the definition is optimal functioning of your body mentally, physically, socially, and spiritually, and not merely the absence of symptoms. So it's not about how you feel, it's how you function. So what determines that health? So what makes everything heal? Like for instance, for you to have a cut, what makes it heal? For you to digest the food that you just ate and not get acid reflux, what makes your body know exactly what to, how much hydrochloric acid? And most of the time people know that it's your nervous system. Hopefully you know that. Sometimes people think it's their heart, but it's your brain and your nervous system. So for instance, when we talk about your brain, I mean, your nervous system carries that life potential. So if we both have cuts, and this is a dead person with a nervous system, and I have a cut with a nervous system, who really is going to heal? We both have nervous systems, but apparently it's the one that's alive. He's dead, I'm alive. So really the true definition is you have to be alive. So I want to ask you right now, if you're really alive, you can be alive, but you're really not alive because you're not, maybe you're sleepy or tired, but truly you can heal. If you're alive right now, if you're sitting here, you basically have the potential to heal, but we want to make sure it's functioning at what percent? At 100%, or the best that it possibly can. And so this is what we're going to talk about, is your spine and your nervous system. See, God put the most amazing power in our body to heal, for your heart to beat, for your lungs to breathe. For everything to work, your brain has to send that power, that light from 2 cells that came together that made you. It didn't even have a nervous system yet. It just knew it had that power to form 4 cells, 6 cells, Before you know it, then 21 days later, it forms this nervous system. And so that the brain starts, then telling, the limbs to form and everything else to form, and finally you get this baby. But for everything to work, you have to have that signal down the spinal cord. And if there's any interference, even a little bit, it's going to start to then shut down. So just like a garden hose, you pinch it, it doesn't allow the water to supply the plant, and therefore it dwindles. So this is how powerful this nervous system is. And one great example is Christopher Reeves. If you remember him, fell off a horse. and you know, he was paralyzed. You know, luckily, you know, man saved him. They put all these machines, they kept the man alive. And it was amazing how, I think he lived for another 10 years thereafter. But if you look at history again, I think everything started to shut down. The machines were keeping him alive outside in, but was that power you know, functioning 100%? Because, you know, he had severed his spine. That brain wasn't sending the signals to every organ and every tissue. So this is why we want to make sure that tonight when we look at your x-rays, that your spine is functioning at the best potential and that we get it there if it's not. And so when we look at the spine specifically, we know that it's so crucial. That's this logo that we have here, the power that made the body, that heals the body. And so we have this as a mantra here, that we know that there's a power within you that heals you, that's never left you, and it's that power that's inside you. So we don't heal anything, that power heals you. My job tonight is just, and as we you know, go and help you, to remove those interferences physically, mentally. We talk about maximizing your potential and your mindset. You know, we remove those toxins that are burning your body. We try to maximize the right nutrients. So we do everything that we can to heal your body, or to allow your body to heal itself. And so when we look at the spine, and it's so imperative that you understand the function, and you see this picture or this model here, your spine should be 100% straight from the front, but from the side you have these curves. And unfortunately, sometimes with gravity, as you see in this image, things start to, now more than ever with cell phones, divert forward. So what happens, that spinal cord gets tethered. So when you look at this spinal cord, this yellow cord traverses all the way down, and in between every one of those vertebrae, you have these holes where these nerves exit, and these nerves supply every individual organ. So for example, if I were to have pressure in this area of my spine in the mid-back, caused me to have mid-back pain, I'm more concerned about what's the function of that nerve here that goes to your kidney, or that gets to your stomach, or that goes to your thyroid. Wherever the nerve goes to, it's going to affect. And so when we're looking at your x-rays, we're looking at function of that. And so normal curve, as you see here in this diagram, is a 45-degree curve of your neck, your mid-back, and your low back. And so most of the time people start to have, like in this diagram that you see here, is a head forward posture. And so now with cell phones, and you know, we see it all too often, you know, we start to kind of look down, and that head forward posture is putting lots of compression to the spinal cord, shutting down that life supply. And so our goal is to restore that function, to not only get rid of your like neck pain, or maybe it's those nerves that are getting shut down that go down to your fingers and they're starting to fall asleep. But more importantly, that nerve goes to your heart, to your lungs, to your thyroid. So we want to make sure that that gets removed and gets corrected. And if you see this diagram specifically, it's showing you the upper cervical spine, the brainstem level, the atlas, which is the first bone. That's where most people have so many compressive factors that start to limit the function of many areas, because you have the vagal nerve that exits at that point, and that's the nerve that supplies all your autonomic nervous system, which helps you to calm down all those organs. So like for instance, if your blood pressure is up, we start seeing, as we start adjusting this area, those kind of symptoms suppress and start to improve. And so if you look at these couple of slides I'm going to show you here, it shows you specifically the spinal cord. And as that head starts to go forward more and more, that compression starts to occur. And then you start to get what we call degeneration. And so that degeneration is basically where these discs in between each vertebra starts to actually compress enough to where you get thinning of the disc. And now if you look at this hole here, this hole gets reduced. The problem at this phase, which is phase 1, and phase 1, most people have no what? Yeah, they have no pain. And this is the problem. It's just like a cavity. You can have a cavity, but you have no idea because there's no pain. And maybe you can have rigidity, but people just pop in like a vitamin called Advil instead of doing something about it. And it goes on and it goes on as time goes by. You have then bone rub on bone. The body, then puts calcium. Before you know it, you get degeneration or these bone spurs. But now what's happening to that nerve? Yeah, it's cutting off that life, and that's that nerve that goes to, let's say, if it's the lower organs like your sexual organs or your bladder, and then you're wondering why you're dribbling as you get older. So not only am I worried about your arthritis and degeneration, it's that nerve that's getting shut off. And so this was my mom, and this is where, unfortunately, by the time she was in her late 40s, me and my sister were having to, change her diapers and do things that we wouldn't, supposed to do at that age, but we would do for her even if she was here. We'd lovingly do it over and over. But the thing is that all she was told that she needed another drug or another surgery. And this is why, guys, it's so important that you start really taking this into account. And so when we look at health, we want to restore these curves. And so when we see patients, and I'm going to tell you a couple of stories here. I have a little boy that I always remember, since I've been in practice over 20 years now, and little Jesus. And if you see, this is a normal curve here, and a normal curve should have this 45-degree angle in a kid, and this is Jesus. It's flat. His mom came here. She was just frustrated because she had been to all these doctors that didn't know really what to do with him other than give him medications for his seizures. He was having seizures, about maybe 12 times a day. She would said that, it was so sad because he was just getting depressed. And so I started working. I think he was 12 years old. I started working with him, and we started to start changing his spine. One of the biggest things that we teach here is we show people specifically the exercises that they need to do. And if you see this slide here, we start with these tractions and these head weights. They're exercises just like you would brush your teeth. You would also maintain some exercises on a periodic basis to restore these curves. So about a month into care, the mom comes in and says that he's now, not having these seizures all the time. And I said, high five, great. She's like, well, why didn't the doctors ever tell me that there was this problem? When they look at an x-ray, what are they looking for? They're looking for, pathology like fractures, tumors, When a chiropractor looks at an x-ray, we have to understand, those things, but we're looking at function of what? Of the nervous system. And so my job is just to remove these, interferences to the spinal cord, and then show people how to restore the function. So we got to the point where after about 2 months, he was barely having these seizures, and about 3 months, he was off the medications. His doctors were just astonished at what was happening. But the whole thing is that we corrected his spine. But what mattered to me more, whenever we showed this x-ray to him, and I showed him, this is your x-ray, but what mattered to him more than his x-ray was the fact that he can go play soccer. And could you imagine being a little boy really wanting to go play soccer, and he couldn't? He was told he couldn't do it because his coach thought it would be a risk for the school. I mean, I'd be depressed. This is where what matters in our office is that people live their abundance and the potential, that abundant life that God wants for us. But a thief comes to lie, steal, and destroy. And so we hope that, we can start changing your circumstances, but show you what to do. So this next guy here, again, this was when I first started practice back in like 20 years ago in Caldwell. And these pictures are the ones that I hold dear to my heart, because these are where I started, where I started seeing changes that I'm so passionate with. This guy's name is Daryl, and he was the father of one of my ex-employees back in that office. And he was a young guy, his teenage daughter, working for us, but he had migraines all the time. And he had some other kids, and he was so, just depressed all the time, couldn't sleep, had insomnia, anxiety, and these migraines that wouldn't let him sleep. So we start working on it. And if you look at his x-ray, that atlas, if you see that first vertebral we talked about, it's literally the head is shifted so forward. So it's putting a lot of compression to the brainstem. And so we started working with him. Now, Daryl, I mean, smoked, he ate all the bad foods. So we needed to change his lifestyle, but more importantly, we needed to take the pressure off of his brainstem. And we started working with him. And what always baffles me is we give these exercises for people to do so they can change this. And when we did the first x-ray, didn't really change that much. And I said, Terrell, are you doing your exercises? And he forgot we had even told him what to do. And so, but he had gotten off, the cigarettes, he had gotten off the Burger King. I'm like, high five, dude, but we want you to restore your curves and your nervous system. He was still having the migraines. And so we start working with him a little bit more. This is about I think the second x-ray we took, and you can see now his head's coming back a little bit. But he still has that head forward posture where we, really went at it. The last x-ray, this is the best we got him. We never got him at 100%. But even if you make a little bit of changes, this guy, brings me this bag of all these pills. And these were the pills that he was taking. And he brought them for me because we have this trash can where people bring some of their meds that they don't need anymore. And I'm like, Terrell, what is this? He's like, this is all the stuff that I'm on. I mean, this is a guy in his, early 30s. So this is where, these are my anchors, guys. I keep these sometimes for a reason because people don't need to live like this. He had gotten to the point where he didn't need this anymore. Now he could be the dad he wanted to be. And he tells me about, that as one of a testimony that he gave me. That's what mattered to us. And we asked that, this is the stuff that you start doing to start changing your life around. And so most people want to do this, but they always have basically limitations. They say, you know what, I don't have time, I don't have money. So I want to discuss that, because the fact is you don't have time. My mom died way too early, so you have to make time. The reality is we got to do anything it takes to do something about your health. And the money thing, if you were to take these 5 essentials, as you see in the slide, if you were to take a nutritionist, a physical therapist, a toxicologist, all these services, if you put it all together, if you go, it's like, thousands and thousands of dollars. If you go to the hospital one night, what are you going to get? I mean, typically you're going to get an MRI, you're going to get all these things, you get all these diagnoses, but you never get answers, but it's even more than $10,000 for a couple of nights. So the beautiful thing in our office, we put this all together in a program. And we make these plans, less than, $2,000. We figure it out for families, we make it work. But if I'm going to work with somebody, I want to make sure that I'm working with people who are committed. And we ask for 3 things. One, that you want to be here. That if you're going to be here, we set up these plans. Typically, we start at like twice a week, and then we go to once a week. We figure out your schedule depending on your phase. And, the second thing, if you're committed, we always ask that, you come to these workshops, that you do the best to live the lifestyle. And you don't have to make them to all, but that you're actually actively involved. And we're here to help those people who want to get help, and we make it happen. Second thing was we check families. We know that we would never not ask for you to not bring your, your kids or your family, because we want to make sure that they get checked. And we do that on us. We get them checked, and we see what we can do for family plans. And then the last thing I ask guys is that if you're going to be a patient in our office, is that you commit to just telling people. I don't care who else, where else, whatever. We're always going to tell you, hey, there's this flyer. Bring them to our community dinner. And then you invite people, because out there's people searching for answers, and you may be that answer for somebody. And the last question I always get is, my insurance. Does this cover it? The fact is, we did away with insurance years and years ago. We've made it happen here for many people, and the way we work with people with that is, the fact is that really insurance really covers for what? I mean, they only care about what they deem as medically necessary, is a term they use. And so maybe they cover 8 to 12 visits if you're lucky. And so if that's the case, we don't take insurance. We'll do whatever we can to help you get reimbursed for that. But the rest of your care, your corrective care to actually change these curves, like if I see you for 24 visits, you know, that's what we can write off. We do whatever it takes to help you, but it's also your decision to take action, your responsibility for your health. So this is where we are going to help you with that. We want to make sure that we're serving people that are committed. So lastly, guys, I just ask that if you decide this is not for you, that's so okay with me. That if I see you anywhere around this town, don't dodge me, you know, and we're going to love you no matter what. My biggest heart is that you just do something about it, whether it's us or somewhere else, that you never ignore your problems and you start acting on your health. So thank you guys for tonight, and we'll see you next time.